It's a cold evening in 1947 somewhere in an English mill town. A mother sits beside her son's bed, watching him cough through the night. She already knows what the doctor will cost if she calls him out: 3 shillings and sixpence. Money the family doesn't have this week, so she waits. She hopes the fever breaks on its own before morning. This wasn't unusual. It wasn't even considered particularly cruel. It was simply how illness worked in Britain for generation after generation. If you had money, you got better quickly. If you didn't, you waited and hoped it passed on its own. Then, on the 5th of July, 1948, that entire equation changed overnight for every single family in the country. For the first time in British history, a sick person could see a doctor without a single thought about what it might cost them. To understand what changed, you first have to understand exactly how broken the old system really was. In 1911, the government introduced national insurance. Working men paid a small amount out of their weekly wages in exchange for the right to see a doctor from a local panel. It sounds reasonable enough on paper. In practice, it left enormous gaps that swallowed millions of people whole. The scheme only covered the worker himself. His wife and his children were excluded entirely from the very start. If a miner's daughter fell ill or a factory worker's wife needed a doctor, the family had to pay out of pocket regardless of what the father's insurance actually covered. Typical fees for those outside the system ran to around 3 shillings and sixpence, a genuinely significant sum for a working household stretching a single wage across a whole week of meals and rent. Millions relied instead on friendly societies, voluntary mutual schemes where working families paid small weekly subscriptions in return for a doctor's care when they genuinely needed it most. Others depended on work schemes run directly by a mine or a mill, a small deduction from every single wage packet in exchange for access to a company surgeon based right there on site. Both systems genuinely helped a great many people get by. A skilled worker's family in a well-organized industrial town might do reasonably well under one of these schemes. A family in a poorer district with no equivalent society to join often had nowhere at all to turn, beyond charity or simply going without treatment entirely. Many of Britain's public hospitals had grown directly out of the old workhouse infirmaries. The stigma of the poor law clung to them for decades afterward. Women called lady almoners would assess a patient's background before treatment even began, deciding whether they could pay, whether they qualified for charity, or whether they should simply be turned away toward a doctor they genuinely couldn't afford in the first place. Being unemployed for any length of time could strip a family of their insurance entirely overnight. Even comfortable middle-class households sometimes struggled too, caught earning just enough to be excluded from the scheme, but not quite enough to easily cover a private doctor's bill without real sacrifice elsewhere. The idea of a genuinely universal health service didn't appear from nowhere in 1948. It had been building through the long, difficult years of the war. In 1942, a report by the economist William Beveridge outlined a sweeping vision for a British welfare state. It named disease as one of 5 great evils the country urgently needed to defeat once the fighting was finally over. Alongside want, idleness, ignorance, and squalor, the idea took hold with an exhausted public in a way few government reports have ever managed before or since. Copies of the Beveridge report sold in genuinely astonishing numbers for a dry official document, passed from hand to hand in factories and forces canteens across the whole country. In 1945, only weeks after victory in Europe was declared, Britain held a general election. The result shocked almost everyone watching from outside the country. Winston Churchill had led Britain through 6 years of war. He was voted decisively out of office regardless. Clement Attlee's Labour Party won a landslide victory. They had campaigned explicitly on turning Beveridge's wartime vision into a genuine peacetime reality for ordinary families. Attlee handed the job of actually building a national health service to a 47-year-old Welsh politician named Aneurin Bevan. Bevan was the son of a miner from the small Welsh town of Tredegar. He had grown up watching exactly the kind of hardship a proper health service was meant to end for good. He brought that memory directly into the job with him every single day, treating it less like a policy brief and more like a personal debt he fully intended to settle. Having the political will to create the NHS turned out to be only half the battle that lay ahead. The other half was persuading Britain's own doctors to actually join it in the first place. The British Medical Association represented the country's general practitioners. It fought Bevan's plans hard from the very beginning. They warned that centralizing healthcare under the state was so completely at odds with the principles of their profession that it should be rejected outright by every single practitioner in the country. Local meetings of doctors up and down the country voted overwhelmingly against joining, at least on paper, in the tense months leading right up to the launch itself. Winston Churchill mockingly nicknamed Bevan the Minister of Disease during the fiercest months of the argument. Some doctors threatened to refuse to join the new service altogether once it finally launched. Bevan responded with a careful mixture of stubbornness and shrewd political persuasion. He eventually won enough of the profession round through concessions that let hospital consultants keep their own private practice running alongside their new NHS work. A compromise he later described bluntly, and rather memorably, as having stuffed their mouths with gold. It worked well enough in the end. By the time the launch date finally arrived, the doctors Bevan needed were largely on board. Then the day itself finally arrived. Aneurin Bevan travelled to Park Hospital in Davyhulme near Manchester to formally launch the National Health Service in person. The night before, at a hotel in the city, he made his feelings about the fight behind him unmistakably clear, telling the assembled crowd that no amount of persuasion could ever erase what working people had genuinely suffered under the old system for so long. At Park Hospital that morning, Bevan personally met the very first patient the new service would treat, a 13-year-old girl being cared for a serious liver condition. He shook her hand warmly and told her she was living through a genuine milestone in world history, a day she would remember for the rest of her life. He was entirely right about that. Speaking to the crowd in Manchester the day before the launch, he had gone even further, declaring that the eyes of the world were turning to Great Britain and that the country now held what he called the moral leadership of the world. People were expected to travel from far away in years to come to learn from what Britain was building. Across the whole country that same morning, doctors, nurses, dentists, opticians and pharmacists who had always worked in entirely separate, often directly competing systems, suddenly found themselves brought together under one single new service for the very first time in British history. Free spectacles, free dentures, free medical treatment of every conceivable kind. In the months before the launch, thousands of new nursing recruits from across the country and beyond had already been gathering at a training school in Hertfordshire, learning the basics of bandaging and patient care so they would be genuinely ready the moment the doors finally opened. For people who had spent their entire lives quietly calculating whether they could afford to be ill, the change was almost impossible to fully believe at first. One young trainee nurse working in Newcastle at the time later described the disbelief perfectly. She said that whatever you needed, whatever kind of medical attention was required, it was simply given to you, totally free of charge, when before it had always been a strict two-tier system built entirely around whether your own family happened to have money that particular week. Parents who had spent years telling their children to simply put up with a toothache or squint through blurred vision now found themselves walking into a surgery and asking for help without a single second thought about the cost of it at all. The pent-up need across the country turned out to be genuinely enormous once the doors finally opened. Years and sometimes whole decades of untreated conditions came flooding through almost immediately. People who had been quietly living with bad eyesight and painful rotten teeth, or conditions they had simply learned to endure without complaint, suddenly had somewhere proper to turn for the very first time. Demand for glasses, dentures, and basic treatment in those first months and years vastly outstripped anything the original planners had ever expected. A direct, visible measure of just how much genuine suffering the old system had been quietly hiding away for generation after generation. Some hospitals reportedly ran out of spectacle frames within weeks simply because so many people had gone without proper glasses for years and finally had somewhere to ask. Success on that scale brought its own serious problems almost immediately. The cost of meeting all that suppressed demand ran far ahead of the original budget within just a few short years. The government was eventually forced to introduce small charges for some prescriptions and dental treatment, a decision controversial enough that it eventually pushed Bevan himself to resign from the government entirely rather than accept it happening on his watch. But the fundamental principle the NHS had been built on never wavered even then, and it genuinely never really has since. Free at the point of use. funded through general taxation, available to absolutely everyone regardless of what they personally earn. Over the following decades, the NHS grew into something closer to a genuine national institution than simply another government department. It became woven so completely into the fabric of ordinary British life that most people now find it almost impossible to properly imagine the country without it standing behind them. Whole generations have now been born and treated and grown old entirely within a system that their own grandparents once had to live without altogether. Ask people in Britain today what they're proudest of as a country, and the NHS comes up again and again without fail. It consistently ranks above the monarchy, above sporting success, above almost anything else people are asked to name in surveys about national pride. It's not hard to understand exactly why that is. It represents something genuinely rare in the world, a promise made to an exhausted country busy rebuilding itself after a devastating war. That illness would never again be something only the wealthy could properly afford to survive. That promise has been tested many times since it was first made, through funding pressures that have stretched services thin, through political arguments about exactly how it should be run and paid for, through genuinely difficult years that have pushed it close to breaking point more than once. And yet the basic principle Bevan fought so hard for back in 1948 has somehow survived every single one of those tests, still completely intact underneath it all. The National Health Service was never really about hospitals or doctors or government budgets, not at its actual heart. It was about a mother no longer having to sit up all night calculating whether she could genuinely afford to call for help when her child needed it most. It was about a working man finally seeing a dentist without wondering how he'd cover the cost, and a grandmother getting glasses she'd needed for years, without a single moment of shame attached to asking for them. If you've ever walked into an NHS hospital and never once thought about what the bill might come to, you're living inside the exact promise made to this country on the 5th of July, 1948. A promise built by ordinary people for ordinary people.